We've seen a rise in mental health conditions, particularly things like anxiety and depression. Do you think that's because we're genuinely seeing increased rates or because more people are speaking about it?
I think it's probably a bit of both.
As a society, our mental health is at an all-time low. Dr Sarah Vohra is a consultant psychiatrist working in the field of psychiatry for over 14 years.
We're an always-on culture. Even getting the train here this morning, I could see people just in their phones scrolling mindlessly.
What's the difference between seeing a therapist and seeing a psychiatrist?
There's often this misconception that all psychiatrists do is prescribe. When eventually people have the strength to come to an appointment, a lot of the time they feel like a sense of failure. And it's not that at all. It is important to debunk that idea that medication is either harmful. We can all feel down, but are you able to lift yourself out of that down moment?
How can we support someone that's close to us that's struggling with their mental health?
Staying calm. So as a mother, I might be like, oh my God, what's wrong with you? And display myself as being really anxious and really worried about her. But it might not necessarily convey to her that it's a safe space to open up.
Hi, I'm Dr Jackson-Spence, and welcome to Vision of Health, the podcast where I talk to qualified experts about what being healthy really looks like. Through our conversations, we'll bridge the gap between the scientific evidence base and you, the everyday person who just wants to live a healthier lifestyle. I am very much on a mission to provide evidence-based, educational content and practical tips that you can actually implement in your everyday lives. Our wonderful sponsors, FemFresh, who have supported me for a number of years now, share the same vision: to open up conversations on taboo subjects, to bust the health myths and improve women's health. FemFresh are not only industry leaders in women's intimate hygiene products, but also committed on educating on all things women's health. And this podcast just wouldn't be possible without their support. You can also catch on socials at femfresh_UK and on their website, femfresh.co.uk. I'm Dr. Frankie, and this is my Vision of Health.
As a society, our mental health is at an all-time low, with rates of common health conditions like anxiety and depression increasing over the last 30 years. And up to 1 in 4 of us each year will suffer with our mental health in England. We've had conversations about mental health and wellbeing earlier in this podcast, and our next guest is here to bring her medical expertise as a consultant psychiatrist into the conversation. Dr. Sarah Vohra is a consultant psychiatrist working in the field of psychiatry for over 14 years. She works full-time for the NHS, subspecialising in mental health of children and young people. She's also the author of 2 books, Can We Talk?, a book to help spot the signs of mental health struggles in children and young people, and The Mind Medic, a manual which shares practical health tips and advice to help cope with your mental well-being. As The Mind Medic, Dr. Sarah shares easily accessible and digestible health tips on her Instagram, as well as working with brands and workplaces on their consumer and employee mental health campaigns, ensuring their information is accurate and helpful. Dr. Sarah, thank you so much for coming on Vision of Health.
Oh, thank you so much for having me.
I'm going to get straight into the questions because my list is getting longer and longer. So much I want to ask you about. We've definitely seen a shift in people's attitude towards mental health, with people becoming much more accepting and open, talking about mental health conditions. What's your experience as a professional psychiatrist in people's attitudes towards mental health?
I think that there's definitely been a shift. So I think in terms of, if we think about social media, there's definitely more people talking about mental health. And I think because it's something that we can see more readily, it gives people more confidence in being able to share their own experience, and people becoming more accepting that other people may struggle in ways that they may not struggle. So I think certainly there is a readiness to talk about mental health in the way that there wasn't perhaps 10, 15 years ago. And I say that from experience. I've specialised in psychiatry for the last 14 years, and never has the conversation been as loud as it has been current day. And I think that can only be a positive thing.
Yeah, absolutely. And I think, we've seen a rise in mental health conditions, particularly things like anxiety and depression. Do you think that's because we're genuinely seeing increased rates because more people are suffering, or because more people are speaking about it, more people are getting a diagnosis?
I think it's probably a bit of both. So I think, as I've said previously, because there is that conversation around mental health, it does give people more confidence in being able to come forward with their own experience. So if you're scrolling social media and you can see that someone is sharing their experience of depression, anxiety, perhaps even bipolar or psychosis, actually you might start to reflect on your own experiences and have the confidence to book that first appointment, or if not booking a health appointment, maybe to have that conversation with a loved one. So I think also there is an increase in pressure societally in general. So if we think about what we're doing now that we weren't doing 10, 15 years ago, I think definitely social media, for all that it has its positives for the reasons I've shared around that sense of community, sharing, feeling of belonging. Because I think often if you do suffer with your mental health, it can feel really isolating. But I think also there can be negatives to social media in the sense of we're an always on culture. We're always switched on to something. And even getting the train here this morning, I could see people just in their phones scrolling mindlessly. There were people that were firing up their work computers and firing off emails. And I think often there's that loss of boundaries between what is our work and what's our downtime and what we actually let into our downtime space. So if I think about kind of the morning routine, when has it been where we can invite the rest of the world in before we've even had a minute to wake up, And I think it's things like that can impact people's mental health. And this is me not sort of calling out social media. I think there's definitely positives to be had with social media, but I think those sort of loss of boundaries can sometimes be really harmful to our mental health. I think also there's this sense of having to do it all. And I think the pandemic probably didn't help with that, because suddenly we were working from home. There was that blurring of boundaries between what was our work and downtime. For many people, the commute is that opportunity to, decompress from the working day. But actually, the thing with the pandemic is that people were literally rolling out of bed and hopping onto a work call. They weren't allowing themselves breaks between work calls, perhaps, weren't even getting outside into the fresh air. So again, that's all that cumulative effect, and kind of having those habits can also negatively impact our mental health. I think also, if I think about, say, my generation, that sort of sandwich generation of women who are trying to juggle motherhood, juggle a career, but also they're looking after maybe parents that are elderly, and the expectation to be able to do it all as well. So I think it is a number of reasons. Certainly conversation has a lot to do with it and what we're seeing in social media and society. But I think we're more pressured as a society in a way that we weren't perhaps 10, 15 years ago.
Yeah, I really resonate with that. It's like that idea, can we have it all? It's like, yeah, but probably not all at the same time. We're definitely always switched on. I have a really strict rule with myself, which I sometimes slip out of, where I'm not allowed to check my phone for emails or social media until I finish my gym workout in the morning. Because otherwise, you're right, you wake up and it's, I'll just quickly answer that email or something. And it's we need to be quite boundaried. I think it's interesting because often when we do set those gaps in the day, maybe it's to take a breather, to have a coffee or go outside, I feel like there's this attitude that it's like self-love, like that we're being kind to ourselves. And actually you could argue, based on what you've said, that it's actually a necessity. Rather than it's being kind to ourselves, it's actually as important as all the other health behaviours we do, like eating nutritious food or exercising and things like that.
I think one of the most important things that people can do is protecting the bookends of their day.
Yeah.
So if we think about the morning, rather than, and I think a lot of people, and myself included, your alarm is your phone. So already you've got that cue to, okay, I've switched my alarm off. What else has the world got to offer? I'm going to check some incoming messages that are coming overnight or check my socials. But I would say really resist the urge. If you're having to use your phone as an alarm, just being really disciplined in terms of, right, I'm just going to switch the alarm off and then do what I need to do to make myself feel better able to manage the day ahead. Because the moment that you check your emails, it creates that sense of urgency. So you're sat there in your pajamas, you've not even brushed your teeth, you've not even had your breakfast, you've not done that morning workout that you've specifically carved out time for. Immediately, there's this sense of, I need to respond to this email right now. And your morning pace is being dictated by something that you've just seen. When that could possibly wait. If your working day doesn't start till 8, 9 o'clock, what's the urgency in responding to that email at 6, half 6 in the morning?
Yeah.
So I think being really disciplined and allowing yourself at least 30 minutes to do what you need to do to be able to better manage the day ahead. And it's not to say that when you eventually come around to seeing that email, it's not going to stress you out. It might well do, but at least then you'll be in a much better position because you will have done, your shower, you'll have had your breakfast, perhaps you'll have done a workout. That means that actually you're better able to manage that stress when it does eventually come. And I think also the latter end of the day, so if we're thinking about when we're winding down to sleep, the temptation can be, and my husband is terrible for this, and I call him out every opportunity I get, it's that multi-screen use. So we might be watching a box set, but he's scrolling on his phone, or he might fire up his laptop to pay an invoice. Well. And, you know, where is your attention focused? But I think also there's a sense that sometimes people might be watching things in bed, scrolling their phone mindlessly in bed. And if we think about what that's doing in terms of our brain is not going to get the cue it needs to wind down to sleep. So one of the things that our body needs is the release of a hormone called melatonin to trigger the pathways for sleep. Now, the problem is if you're looking at screens, that the blue light from screens blocks the release of that hormone called melatonin, which means that it delays those pathways being triggered. So I think if there's one thing that you can try to do is to protect the bookends of the day, and not get pulled into someone else's sense of urgency, and actually really carve out that time to look after you.
Yeah, I think that really hits the nail on the head. I actively try and reduce like micro stressors in my day. So if it's, you know, I have to wait up to an alarm, that's a stressor. But then can there be other things that I would use, like giving myself enough time to not be rushing, not like I was this morning. You know, like reducing little stressful things where you can, because some things are out of our control. Aside from kind of protecting time in your day and having some downtime, are there any other kind of behavioural or lifestyle habits you would suggest people do that are protective for their mental health?
So I think one of the tools that I suggest people do is something called PREPARE. So I love an acronym because I think it's just then it's easy to remember and it's easy to tick off. So PREPARE is first pen, paper and plan your day. So if you don't want to go old school with a pen and paper, just fire up the notes section of your phone. And you might want to do this on a Sunday evening. It might work better for you to do it first thing on a Monday morning. Whatever works best for you to have that 5-10 minutes to carve out the PREPARE acronym. R is routine. So wherever possible, having a really clear distinction between your day routine and your night routine. And again, I sort of go back to the pandemic when actually there was a real blurring of what was our day work routine and what was our nighttime routine. If you are still working from home, so there are people that have the luxury of having that hybrid model of work. And the problem is they often forgo the things that they would do if they were going to go into the office. So actually they may have a shower, or they may delay their shower, or they may just get dressed into loungewear. And they may not even leave the house if they're working from home. So I think wherever possible, even if you are working from home, having that really clear distinction about, no, this is my work time. So whether that's having a separate space in your lounge where your laptop's fired up, or, you know, if you've got a separate room, brilliant. Being able to get yourself showered and dressed with purpose. So just really resisting the temptation to either stay in your PJs or, you know, in a lounge set, just making sure that you dress in the way that you would if you're going to work. Obviously, comfort's a bit more key when you're working from home. And making sure that you have those natural pauses in your day. So I think the problem is that if you are working from home, or if you have lost that routine, you're less likely to take breaks and things. So I think that clear distinction is really important. So R's for routine, E is exercise. So it doesn't have to be a HIIT exercise. It can be any form of movement that gets you moving for 30 minutes or more. And some of that could be incorporated into that routine. So taking yourself for a walk around the block. If you're working from an office, is there opportunity for you to leave the office for 15-20 minutes, maybe to grab a coffee, making sure you're exposed to natural daylight as early in the day as possible. So again, that's as much as it is for the movement. So we know that exercise is brilliant for helping our mood, helps reduce anxiety and stress, and it's also really helpful for sleep. But more than that, especially in the winter months, getting outside in daylight is really important for helping regulate our natural sleep-wake cycles, our circadian rhythm, which helps control the release of that hormone that I mentioned, melatonin. So as much as possible, if you are able to, as early in the day as possible, getting exposed to natural daylight. Then P is pause. So again, there's a real temptation, and I'm terrible for having lunch at my desk. I'm really awful for it, to the point that yesterday I went into my work kitchen for the first time in ages, and I was like, oh my God, what are you doing here? But it's so important just to pause, not to feel that you've always got to be on. Because if we pause and take regular breaks, we reduce the risk of that stress accumulating, reduce the risk of burnout. A is avoid social media notifications. So the world's pretty stressful right now. And I think often what can happen is when we're pulled into those notifications on our phone, it can ramp up anxiety levels, it can distract us. So wherever possible, trying to set your phone such that you're not getting those banner and news alerts, because again, that can distract your focus from what you're doing. But if anything, it can actually ramp up your anxiety levels. R is relationships. So I think often in the winter months, we can kind of just get home and just get into our PJs and not want to socialize because it's cold and we just want to hibernate until spring, summer. But actually making a point of planning an interaction with someone, whether that's a telephone call, whether that's doing a workout with them, or just going around for a cuppa. But we know that particularly in times of stress, the people we surround ourselves with can help us make sense of that stress and also reduce the effect it would otherwise have on us. And then finally, eat well and keep hydrated. So I'm mindful that I've thrown loads of information at you, but prepare is pen, paper, plan your day. R is for routine. E is exercise and exposure to natural daylight. P is pause. A, avoid media and social media notifications. R is relationships, and E, eat well and keep hydrated. And if you use that as kind of the bones of your week and see how much you can get ticked off, I think you can stand to sort of feel a lot better in yourself, certainly.
I really love that. And I think they're like micro changes you can make to your day. They're not things that people listening need to completely overhaul their life to implement. I think sometimes it really helps to have that like external validation from an expert to say that's enough. You know, people think that they need to start on Monday to completely overhaul their life, and actually some of those things you could start today and just say, today I'm going to go outside and eat my lunch and not be on my phone or at my desk. So they're really useful tips. Thank you. Some of them I can definitely take on board. I am going to ask a question that I think people will be interested in. You're a consultant psychiatrist. Many people, when talking about mental health, will see, particularly on social media, therapists or psychotherapists talking about mental health and well-being. What's the difference between seeing a therapist and seeing a psychiatrist?
So there's kind of a broad spectrum of professions, I suppose, that help people with their mental health. So as a psychiatrist, I'm medically trained. So from background, I went to university and studied medicine. So my undergraduate study is in medicine. And then I've had to do my general doctoring for a couple of years before I went into my subspecialty, which is psychiatry, which I've been doing for 14 years. Therapists, can approach that profession from a number of angles. If you're a psychologist, your undergraduate study might be in psychology. There are other sort of disciplines who might have had training in a particular therapy, similar like counselling. There might be short courses available for people to be counselling. So there is a real mix of disciplines that offer support for people in their mental well-being.
And so an appointment with a psychologist and going through therapy might going through like childhood trauma and assessing why you behave a certain way. Would an appointment with a psychiatrist be different to that?
So I think there's often this misconception that all psychiatrists do is prescribe. And I think actually if you were to walk into my team and ask what my main role was, they would probably say prescribing would be one of the bottom ones.
Yeah.
So I think I work very, very closely with my psychologists, and there are a lot of similarities in the sense of when we have a young person or when we have an individual present to us at that moment in time, one of the things that we like to do over a period of time of getting to know them is something called formulation. And formulation is where we try to decide, why is it that this particular individual has presented with this particular set of problems at this particular moment in time? And that will consider everything from, like what you said, their early years experience. It might look at kind of their family background and how the family operates and functions. It might look at things like family history of mental illness. So it's almost kind of almost like an investigative piece of work, really, of pulling all that relevant information together such that we're then able to say this person is struggling with depression because of these reasons. Mm-hmm. So psychologists and psychiatrists work very similar in that respect. The way that we differ is psychologists offer therapies, first and foremost, as well as that formulation work. And psychiatrists also can offer therapy. So during my training, I have done training in family therapy and also cognitive behavioural therapy. So there is not necessarily an expectation that psychiatrists will do that in their day-to-day, but that's certainly something that is required in their training. But one of the big differences is prescribing. And as a psychiatrist, I work very closely with my psychologist, that if for whatever reason the young person or an individual is struggling with their mental health such that they're not able to engage really well with the psychologist because of their symptoms, we may consider the role of medication and then prescribe and monitor them.
Yeah. I'm really glad you brought that up, because I had a conversation earlier in this podcast about sort of the role of medication versus the role of doing the work in terms of, psychologically. And I think it's like anything with any medical condition, you do both. So if you have someone who has diabetes, you might give a diabetes medication, but you also will say exercise, make these dietary changes. And I feel like, I'm not a psychiatrist, but I see the role of medication in the mental health setting similar to that. What is your view on medication, in the sense of how damaging is it when we kind of demonize medication in that setting? Because it's not just anxiety and depression, is it? There's lots of mental health conditions that need medication.
And I'm so glad you brought that up, because often, again, if we think about social media and people sharing their experience of poor mental health and sharing their experience of being prescribed medication, you do have two camps. You have the camps where medication has been, in some respects, life-changing, and then you've got the other camp where medication hasn't been helpful. And I think often what is difficult is when you've got someone who's really vulnerable and who probably does require medication, accessing that content online, it's really confusing, and it might make the difference between them seeking help or not seeking help. So what I would say is medication is not for everyone. Medication doesn't always work for everyone, but I think for some people I've seen it be life-changing for them. And it's not mutually exclusive in terms of just because the therapy didn't work, it doesn't mean then you're only going to require medication. Often what happens is, if we get individuals who are highly anxious or highly depressed, and if you try to sit with them to try and do the therapeutic work, they are too distressed to be able to engage in that. And actually what can help is offering medication to help take the edge off it, or maybe to lift their mood, improve their concentration, improve their feelings of hopefulness as well, to be able to then engage with the work. And you mentioned other conditions. I have seen individuals with bipolar illnesses, with schizophrenia, where if someone's having an acute psychotic episode, sitting them down and talking about their triggers or thinking about ways they can manage those sort of early warning signs that indicate they're going to go into a psychotic episode is unhelpful. And actually what you need to do is treat the acute presentation. And so I think often when we see these messages on social media that demonize medication, I think it's not as clear cut as that. So it's not a case of it doesn't work, it's a cop out. These are things that when eventually people have the strength to come to an appointment to consider medication with me, a lot of the time they feel like a sense of failure. They feel that actually all this messaging has made them feel that I've failed in some way. And it's not that at all. And I think also a common misconception is, if I do take medication, that's it, I'm going to have to take it lifelong. And that's not the case either. So it may be that if we use the example of someone who's severely depressed, who is suicidal, so does not see past tomorrow, and if we treat that severe depression with antidepressants and we start to see after a few weeks, they have more energy, they feel more motivated, they're able to concentrate more, maybe some of that hopelessness has eased, then being able to engage with the work alongside the medication. And actually, as the work sinks in, as they do the lifestyle stuff, the therapeutic stuff, we may reach a point in 6 months, a year's time, where we can think about them coming off the medication. And that's not the case for everyone. Some people may remain on medication longer term, but I think it is important sort of to debunk that idea that medication is either harmful, because I think for so many people it does make a difference.
Yeah. I think you really hit the nail on the head there, that it's not black and white. It's not just medication or engaging with therapy. It's often a mix of both. And that message is often not portrayed accurately on social media. So thank you for clearing that up. I would love to ask, talking just about, you mentioned it a little bit there, about how you would treat patients. Earlier in the episode, you talked about these protective behaviours we can do in life to support our mental well-being and hopefully prevent a mental health condition occurring. Are there differences in the ways that you treat patients that have an existing mental health condition? So, for example, if I was to prevent myself feeling anxious or low in mood, I might do those things like exercise, eat well, spend time in my day relaxing. Versus if I had an established diagnosis, would it be the same advice, or are there different things that someone with an established health condition should be doing?
I think the advice that I gave earlier is applicable to anyone. It may be that some people might find it harder to implement because if they are severely depressed or severely anxious, they may not have the motivation and energy to be able to take themselves for a walk around the block or to be able to concentrate or focus on their work. But I would always say is, as it all goes hand in hand, so if you have got someone that is seeing someone like myself, I would always give the advice around, sleep hygiene, eating well, exercise, alongside the medication, alongside maybe the therapy that they're accessing. So in short, no, actually, the advice would be the same.
How would someone know if they needed medication?
So I think it depends on where you are in terms of your health journey. So it may be that if you are someone who hasn't even brought to attention of your GP that you're struggling, I think that for me would be the sort of the first port of call. It may be that you're already under your GP, or you may already be under a mental health service, in which case if you're not able to engage in the therapeutic work that's being offered because you just can't concentrate, or when your therapist is suggesting you sort of activities or homework tasks to do in your spare time between sessions, it just feels near on impossible. Yeah. And I think if it's been something that you've been persisting with for a long time, so if you felt like this for a long time, if you've been engaging in therapy for a long time and there's still no shift, that might be a point to consider medication.
And what I love about that is it just kind of shows it's never too early to start talking about your mental health, because I think sometimes, maybe not so much anymore, people often feel like they need to leave it until they're at rock bottom before they seek advice and help for their mental well-being. At what point do you think it goes from having a low period in your life or feeling anxious about something versus it becoming an actual disorder and an actual diagnosis?
So I think, you're right that we can all experience moments where we feel low in mood, but it's how much that low in mood persists. So if you're feeling low in mood, and that there might be a trigger to it, there may not be, but how much is it affecting your day-to-day? So if we think about something like a clinical depression, that is a low mood that persists for longer than 2 weeks. And so like the predominant mood is one of feeling low, feeling sad. They may struggle with low energy. They may not have pleasure in things. So things that you used to enjoy doing suddenly feel like a real slog all the time. You may struggle to concentrate. You may not have any motivation to do anything. You may be off your food. Some people, particularly over the winter months, might find actually that appetite increases. You might struggle with your sleep. And then on the severe end of the spectrum, there are people that may turn to self-harming to manage how they feel, or they may have suicidal thoughts or even act on those suicidal thoughts. So I think for me, the key is looking about how long the symptoms have lasted for, how much they infiltrate your day-to-day, how much do they affect your personal relationships, how much do they affect your work life, your social life. And I think that's the key really, because we can all feel down, but are you able to lift yourself out of that down moment? Are you still able to do the things that you enjoy doing? Do you still have the energy and the motivation to take yourself off to work? So I think those are all things to look out for.
Yeah, I think we have a real misconception that we're supposed to be happy all the time.
Yeah.
And social media doesn't help that because we show our happy moments and our highlights. But I certainly have down days, if anyone needs to know that. So I think one of the misconceptions, particularly on social media, is that mental health conditions are all about what's in your head and your thoughts and your mood. But there are physical symptoms, aren't there?
Yeah, absolutely. And, if we take the examples of anxiety and depression, if you're feeling anxious, it might be that you feel the physical symptoms. So it might be sweaty palms, heart racing, struggling to catch your breath, maybe knots in your tummy. If you're depressed, then I've already mentioned kind of that loss of appetite or increase in appetite, problems with sleep. But often people, sort of adults might experience a loss of libido. So just that disinterest in having sex, or being intimate with someone. So that they're all signs that may also indicate that something's not quite right. And I'd encourage people to think about those physical symptoms as well.
Panic attacks, something that's very, very scary if you have one. What can someone do if they're experiencing a panic attack?
You're absolutely right. They can be terrifying for a lot of people. I think people often sense this feeling that they're going to die, that this panic attack's never going to end. And I think if you're able to, in that moment, to remind yourself that this will pass, it's not going to last all day, it will pass. You are not going to die from it. I think often trying to distract yourself and go back to whatever activity you were doing before the panic attack came on can sometimes feel near on impossible. So if you find that you are hyperventilating and struggling to calm yourself, often a breathing exercise can be really helpful. So I like to get people to think about a rectangle. And so you breathe in for four counts, and then pause, and then slowly exhale for 8 counts, and then keep doing that and sort of follow the trace of the rectangle up until you feel calmer. And I would always say that, say you were out in public when the panic attack happened, there can also almost be a temptation to avoid certain areas because that's where you had your last panic attack. And I think often avoidance can lead to that anxiety building. And it's really important to almost kind of bank up evidence of, I know that not every time I go to this place, I'm going to have a panic attack. But I think in terms of managing the panic attack as it stands, I think being able to remind yourself that it's not going to last forever, you're not going to die, and doing that breathing. So making sure when you're breathing in, you're doubling up the count on your breath out as well.
I remember having a panic attack once in a 4th year medical school exam, and they told me I had 30 minutes left and I had like half the exam paper left, and the whole room went white. I had this like ringing in my ears, and then when I got my vision back, all of my text was like smeared and it was sweat dripping off me.
Oh my goodness.
And I wish I had that advice when I went through that. I think it's useful to have some practical tips that you can try and remember. You mentioned just then about if someone is experiencing anxiety in a situation, not to avoid that situation. I think that's really useful advice. You hear people feeling anxious about things that we would say you shouldn't be anxious about, like maybe going to a supermarket or something, being in a crowded space. So is that people shouldn't avoid doing those things and actually doing them might help the anxiety?
Obviously within reason. I suppose it depends on what that anxiety-provoking situation is. If it's an anxiety-provoking situation that genuinely could bring you harm, then obviously the advice would be that you avoid it. But I think in situations where you have experienced those panic attacks, it's come out of nowhere, I think often when we do avoid things, it can just mean that anxiety is just going to simmer, and it's going to confound this idea that area is to be avoided because we know we're going to get a panic attack. And we know that fear builds the longer we leave something, the longer we avoid something.
Okay, great advice. We often throw around terms related to mental health like, oh, I'm so OCD about this, or, oh, I'm so depressed. Can you clarify what OCD really is and how damaging it is for us to be using the language incorrectly?
So this is one of the most common things. And when I get people in clinic talking about other people, or maybe friends or family member that have referred to themselves being a bit OCD, I think they can feel that it in some ways undermines the seriousness of what their experience. So I think it's always really helpful that if you are one of those people that says, oh, I'm a bit OCD, think about what you actually are describing. Is it that you're just a bit particular, or you like things clean or a certain way? So I would encourage people to use that sort of language rather than OCD. And the reason being is OCD is a mental illness, and it's a really serious mental illness that's really disabling for a lot of people. So there's sort of 2 components to it. So the obsession is where the person that's affected might have an intrusive thought, or they might have an image that continually pops into their head. It's difficult to resist, it's irrational, but it creates a lot of distress. So someone may have a thought that their house is going to be burgled and that their family are going to come to harm. That might be the obsessional thought that comes into their mind time and time again. They're trying to think about something else, but it's near on impossible. And then the compulsion is an act or a ritual that someone does to be able to counteract that distress that they feel from the thought. So in that situation, someone might be checking their locks maybe up to 20 times a day before they can leave the house for a work day. Or they may get to the point where they can't leave the house because the checks are taking that long. So it's really at what degree those rituals are impacting day-to-day life. So if we think about kind of when people flippantly say, I'm a bit OCD, it's not actually disabling them in any way. It's not actually interfering with their day-to-day life. There may be some people that just have the intrusive thought. They might not have the accompanying ritual, but it's very time-consuming. It's highly distressing for a lot of people. And for many people, it does require therapy or in some cases medication.
I think it's interesting what you say there when people have these particular habits, because often when people say, I'm a bit OCD, it's actually a positive thing. I'm really OCD about everything looking pretty or my house being clean. And that often would be a positive thing in their life. But actually for people with OCD, those intrusive thoughts are not bringing them the satisfaction. They're not getting a reward from that. It's actually huge distress.
Yeah, absolutely.
I think that's really important to highlight. Thank you. You mentioned before about how some people, when suffering with their mental health, can see it as a failure, particularly if they need to seek help or take medication. I think many women, after having a baby or going through pregnancy, feel low in mood after, and it's this time where society expects them to be really happy. How normal is it for new mums or ladies who have been pregnant to experience a period of low mood?
Really common and more common than people think. So 80% of women will experience the baby blues. So that couple of weeks after birth where their mood can feel like it's all over the place, where they feel quite tearful. They should be excited, but they feel like they're not coping. So it is really common, and perinatal mental health problems can affect right the moment you are announcing that pregnancy through to that first year after the child's born. And I speak from my own experience. So my daughter's 9 now, but when I had her, I remember feeling really overwhelmed that I should be doing things a certain way. Social media was kind of in its infancy there. But I remember looking at kind of perfect bloggers and thinking, oh my God, how have I got this so wrong? Am I doing something wrong? And she was the only child that would be screaming in a class. And it is really overwhelming. And I think often when we kind of compare our pre-baby life, it may be that we are normally on top of things and we're able to, we've never failed at anything. And actually suddenly a baby comes along and it upsets kind of maybe the balance that you had pre-baby, and you have to learn new things and you might not get those things right first time. So it is really, really common. And all I could say is really just speak to your partner, friends, family, and being really open about how you're feeling, not feeling that sense that you have to do it all, because you don't have to do it all. Accepting help is really important. I know personally, I was someone that I thought, God, if I accept help, then I can't do it. I'm a failure. But actually accepting help, can't say a thing. Accepting help, particularly in those early days, so important. And, that is just women who maybe they didn't have any pre-existing mental health conditions. So it's really common to be struggling after having a baby. But there are also women that may have had pre-existing mental health conditions, or maybe there's a family history of mental health conditions around pregnancy or postnatally. And I would really urge those women that if you are expecting a baby and you either have a pre-existing mental health condition or you're aware that there's a strong family history, I'd really encourage you to speak to your midwife, because there are specialist mental health services that support women in and around their pregnancy and up to the first year after birth. So the support is available.
That's great to know. So how, in general, can people protect and improve their mental health and well-being and cope with negative emotions? Because we've normalised that some negative emotions are normal.
I think being really open, being able to spot signs when you are struggling and being able to have conversations with people around you. So conversations in the home, conversations in the workplace. I think building up a bit of a toolkit in terms of what helps you. So we've shared lots of ideas in terms of exercise, sort of sleep hygiene, things that people can do every day, minor tweaks that might be able to improve how they're feeling. And one of the tools that I like to think of is something called a day in the life of. So if you just map out a typical day for you, so what time do you normally wake up? So this is on a good day. So if things are good, what does that look like? What are you having for your breakfast? What's your morning routine look like? How are things at work? What do you tend to do in the evenings? What time do you go to bed? That way, that if things start to shift, if you start to feel out of sorts, you can kind of look back and think, well, I noticed that actually I wasn't going to bed until 11 and normally I'm in bed for 10 Or I notice that I'm spending a lot more time on my phone than I would normally. Maybe actually if I try and tweak that and reduce the time spending on my phone, then I might feel better in myself. So I think having that self-awareness of when things are good, this is what I know works for me, and being able to tweak things and not expecting instant results. So people might be hearing this and think, okay, I'm going to start working out every day and I'm instantly going to feel better. But it's a sort of trial and error of what works for you and sort of persisting with that.
And it can be so hard to do that, can't it, when the weather is so cold and miserable? I think lots of people experience like low motivation and low mood over winter months when it's dark. How can people cope, particularly in the winter?
I'm terrible for the winter because when you wake up, you think, have I even gone to bed?
Yeah.
So I think if we think about that PREPARE acronym that I shared, and this might be an exercise that people can do now as they're listening, is jot down PREPARE and think, okay, have I made a clear distinction between my day and night? If you're commuting in the dark, chances are you might not have gone out for that daylight in the day. So where's your distinction between your day and nighttime routine? Have you had any sort of form of movement regularly at all? Are you taking regular breaks? Are you having a bombardment of social media and media notifications? Are you carving out time for those friendships and more positive relationships? So I think just I think just taking that as a starting point can be really helpful. And then if you're noticing, well, actually, I don't think I've seen anyone for the last week, set up a time to see a friend. If you're noticing that actually over the summer you're exercising more frequently, but you've not done a workout since before Christmas, then try to encourage a bit of gentle exercise into your routine. So I think writing down PREPARE and thinking about which tweaks you can make, and not thinking that the world has to stop just because it's got a bit colder and a bit darker, and it might just need a bit more kind of structure that means that it holds you accountable.
Yeah, and I think just bringing things into our kind of conscious awareness, in the summer, you're right, it's so much easier to think, you know what, I'll go out for a walk or a run after work when it's nice and sunny, or I've got plenty of time this evening to cook a meal from scratch. Whereas when you finish work at 5:30 and it's dark, you think it was bedtime.
Exactly.
And we don't have the same motivation, and you can't rely on motivation. You've got to consciously think, these are the things I need to do today for me that make me feel good. Because when it comes to our work, we do it, don't we? We make an effort to do those little things. But when it comes to looking after ourselves, we tend to neglect it.
Yeah.
A question I often get asked on social media when I speak about mental health and well-being is, how can we support someone that's close to us that's struggling with their mental health?
So I think if we think about that sort of day in the life of exercise, it might be someone that you live with that you're concerned about. It might be someone that you work with. We all have kind of patterns and routines. So if I take my daughter, for instance, so she's 9, and if I think about, say, her morning routine, she normally gets up at 6 o'clock in the morning. She's bounding out of bed. She normally tells us a morning joke before she goes and gets herself ready. And then she'll come downstairs. She'll have her favourite breakfast. She'll wolf that down. She'll watch a bit of TV. We get into the car. And then when I drop off at school, she's fine. She's happy to go. She's not clinging to me. But if I noticed that it was 6:30, 6:45, and she still hadn't got out of bed, or if she did get out of bed, she was a bit more sluggish, or she wasn't cracking her usual jokes, she was off her food. When I dropped her off at school, she was clinging onto my leg. Immediately, there are signs there that indicate that something's going on for her, whether that's with her physical health or her mental health. And obviously, if I rule out anything physical in the first instance, it might encourage me to have a conversation with her. Like, I noticed this morning that you weren't bounding out of bed as normal. And I think often people feel that when they do the whole, how are you? The response from the other person is, I'm fine. And then that's the end of the conversation. Whereas I love an acronym. So I've developed FACE FEAR, which is more about having confident conversations so that you're not going to be put off by someone just saying, I'm fine. Because chances are you might not come back to that conversation because they've told you that they're fine and you've got a million and one things that you need to be getting on with. So FACE FEAR is about having a face-to-face conversation. A is about being attentive, so really listening to what they're saying to you. C is about staying calm. So as a mother, I might be like, oh my God, like, what's wrong with you? And I might display myself as being really anxious and really worried about her. But it might not necessarily convey to her that it's a safe space to open up. Like, Mummy's looking really anxious. Mummy's really angry with me. I'm not going to share how I'm feeling. So wherever possible, staying calm. It's not to say that you can't be affected by what they're going to share, but it's about conveying that sense of this is a safe space. E is encouragement. So if you do get that shrug shoulder, I'm fine, it's just encouraging them, saying, I've noticed that you are struggling and I want to help. Then the fear aspect is if you're coming up against a brick wall time and time again. F is the fact. So what have you noticed? So I've noticed that you're not getting out of bed till 7 o'clock in the morning. I've noticed that you're not eating your triple chocolate muffin that normally you wolf down. I've noticed that you're clinging onto my leg when I'm dropping you off. So they're the facts. Now, if I was to list a load of facts that I'd noticed about you, chances are you'd get defensive and say, no, that's no. I don't know why you're saying that. No, I'm fine. E is about explaining and putting it into context. You normally wolf down your chocolate muffin. You normally wave me off and tell me not to stand at the school gate and just to get in the car straight away. So it's about putting your worries into context. And the A and the R is about agreeing in action and reviewing. So again, when you have that how are you conversation, chances are you don't return to the conversation, but the agree and review is about saying, look, I've noticed that something's wrong. I know you're saying you're fine, but do you mind if we check in a week's time or something and see if things are any better? And it's about kind of holding you both accountable to having that conversation and revisiting it, because all too often those first conversations start and then it gets neglected. And I think it's really important to be able to come back to, because she might turn around to me and say, I've fallen out with my best friend at school. In which case you'd expect that things would improve as either that relationship improved or, what happens sort of days, a week down the line. In which case, when you come back to review, I've made up with her now, we're fine. And actually the routine resumes back to normal. But you'll never know that if you don't revisit the conversation.
Yeah. I think we all need to get better at that whole I'm fine thing. We need to normalize that sometimes we're not fine.
Absolutely.
I'm actually quite good at that. If someone says to me, how are you? And I'm having a really stressful day, I'll be like, everything's going wrong today. And I'm quite good at sharing negative emotions as well. But as a society, we are so quick to say I'm fine.
Yeah.
And actually a little bit more vulnerability is only going to help relationships, and also normalizing that we all have those down periods.
Absolutely.
I could speak to you for hours. This hour has absolutely flown by, but I'm going to wrap up with my final question, which we've asked every guest on this podcast, and it's my favourite. What is your vision of health? What does health look like to you?
Sometimes I am terrible at taking my own advice, but the one thing that I have to do without fail is move in some way. And even when I go on holiday, me and my husband tag team it to go to the gym. We're one of those really annoying people that work out on holiday, but I enjoy it because I know that it helps me manage the day ahead. It helps me manage the stress. It lifts my mood. It helps my sleep. So for me, I know that things are slipping when I've not been able to regularly work out. So I suppose my vision of health is just being able to prioritize movement. And like I said earlier, it doesn't have to be a HIIT workout. Some of my best workouts are just a walk around the block or even shopping, just being able to get your heart racing just that little bit. So I think for me, sort of that balance of being able to do my day-to-day job, but making sure I prioritize movement.
Love that. Similar to mine. Thank you so much for your time today.
You're welcome.
A great conversation. I'm sure everyone's learned so much. I certainly have. I just want to thank you for your time.
No, thank you.
Thank you so much for listening to Vision of Health. I hope you take away some realistic and practical health advice that you can actually incorporate in your busy lives to become the healthiest version of yourself. If you want to hear more from me, then please do hit the subscribe button, share this post, and also go follow me on Instagram at Dr. FrankieJS, where I post a regular series of Women's Health Wednesdays with our wonderful sponsors, FemFresh. I'll see you next time.